Sakit. Okay. Then lastly, you're going to palpate the umbilicus and surrounding area for swelling, bulges, or masses. Tapos alin. Sakit, sir. Sakit. 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 Okay. Then we're going to palpate the aorta. So use thumb and first finger, or use two hands and palpate deeply in the epigastrium. So karon sir, magpalpate sa imong aorta. Sakit sir. Sakit. Okay. Next is you're going to palpate the liver. So first is you're going to stand at the client's right side and place your left hand under the client's back at the level of the 11th to 12th ribs. Then lay your right hand parallel to the right costal margin with your fingertips point upward or toward the client's head. Then ask the patient to inhale, then compress upward and inward with your fingers. So karon sir, ako ano imong we're going to palpate your liver sir. Okay. Sige sir, I want you to inhale and exhale sir. Sige, inhale. Exhale. Sir ha. Sige, inhale. Exhale. Sige, inhale. Exhale. Okay. The next is you're going to palpate the spleen. So stand at the patient's right side, reach over the abdomen with your left arm, and place your hand under the client's under the posterior lower ribs and pull up gently. Then place your right hand below the costal margin with the fingers pointing towards the patient's head. Then you're going to ask the patient to inhale and press inward and upward as you provide support with your other hand. Then you're going to document the size of the spleen in centimeters below the left costal margin and note for consistency and tenderness. So karon sir, magpalpate ko sa imong spleen. Yeah. Sige sir. Sige sir, ako ni palpate ang imong cancer. Sige, inhale sir. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Okay. Next is assessing the kidneys. So to palpate the right kidney, you're going to support the right posterior flank with your left hand and place your right hand in the right upper quadrant just below the costal margin at the mid-clavicular line. So, karon sir, we're going to palpate your right kidney. So, sige sir. Marag breath ang gihapon sir. Sige, inhale. Exhale. Sige, inhale. Exhale. Sige, inhale. Exhale. Okay. Then to capture the kidney, ask the client to inhale, then compress your fingers deeply during peak inspiration, and ask the client to exhale and hold the breath briefly. Then gradually release the pressure of your right hand and palpate the urinary bladder as well. And you're going to begin at the symphysis pubis and move upward and outward to estimate bladder borders. So, karon sir, we're going to locate your kidney. So, I'm going to ask you to inhale, sir. So, inhale, sir. I-hold lang din, sir, ha? I-exhale. Isa ginawa, sir, ha? Inhale. Sige, sir. Exhale. I-hold sa, sir. Isa ginawa. Inhale. Exhale. I-hold. Okay, inhale na. Ginawa na, normal breath. Then, magpalpita sa imong urinary bladder. Sige, inhale. Exhale, normal breath lang. Sige. Okay. Next is testing for ascites. So testing for shifting dullness, put the patient in remain supine position and percuss the flanks from the head and percuss the flanks from the bed upward toward the umbilicus, and you're going to note the change from dullness to tympany and mark this point, and you're going to help the patient turn into the side and percuss the abdomen from the bed upward after that, and you're going to mark the level where dullness changes to tympany. So karon sir, mag-percuss ko sa imong kuan kanang sa imong umbilicus. So we're going to note the change from dullness to tympany, and I'm going to mark that point, okay? Okay. So karon sir, I want you to turn into side, sir. So dili magpadlong ka dito, sir. Gilay. Okay, sir. Balik na, sir. Then, in fluid wave test, So let the patient remain in supine position and tell the patient that you need his or her assistance with this test. The next is you're going to ask the patient to place the ulnar side of the hand and the lateral side of the forearm firmly along the midline of the abdomen, and firmly place the palmar surface of your fingers and hand against one side of the client's abdomen, and you're going to use your other hand to tap the opposite side of the abdominal wall. So karon sir, I need your assistance with this test sir ha. So I want you to place your ulnar side of your hand and lateral side of the forearm. So firmly along the midline. So ingin na sir. Na okay. Okay sir, butang lang ni isa sir. Sir ha. Sige. Sige sir, sa pika sa pod sir. Okay. Okay, ubos na sir. The next is testing for appendicitis. So, in assessing for rebound tenderness, palpate deeply at 90 degrees into the abdomen, away from the painful or tender area. Then suddenly release pressure and listen and watch for the client's expression of pain. And also ask the patient to describe which hurt more, if the pressing or the releasing, and where on the abdomen the pain occurred. So, karon sir, mag-assess ta sa rebound tenderness dira sa imong para makita nato kung nabi appendicitis. So, karon sir, I'm going to palpate lightly your appendix. So, karon sir, mag-ingon ka sir kung asay masakit sir ha, kung ang pag-release ba or ang akong pag-press. Wait lang sir ha. So, asa ang masakit sir? Ang pag-release or ang pag-press nako? Sakit press. Sa both, walay sakit. Okay. Again sir ha. Sakit sir, dili. Sa asay masakit ka nang sa pag-press or sa pag-release? Walay sakit sa both. Okay. Okay. Then moving on for testing for referred rebound tenderness. So I'm going to palpate deeply in the lower left quadrant and quickly release pressure. So karon sir, I'm going to lightly palpate your left lower quadrant. Sakit siya sir. Dili. Sakit. Okay. The next is we're going to assess for psoas sign. So ask the client to lie on the left side, hyperextend the right leg of the client. So karon sir, I want you to turn to the left side sir. Ana sir. So I'm going to hyperextend your feet sir ha. Your legs. Okay. sakit imo diri sir? Kana may sakit? Okay. Balik na sir. Next is you're going to assess for obturator sign. So support the client's right knee and ankle and flex the hip and knee and rotate the leg internally and externally. So karon sir, I'm going to lift your right sir. Karon sir, ako i-kuan sir ha kung nabay sakit imo kuan. May sakit imo kilid sir.
Nice.
Kana. Okay. Then you're going to perform a hypersensitivity test. So stroke the abdomen with a sharp object or grasp a fold of skin with your thumb and index finger and quickly let go. So karon sir, we're going to test for hypersensitivity. So mag-ingon lang ka sir ha kung nabay sakit sir.
Okay.
Kana sir. Sakit? 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 Okay. Then, in testing for cholecystitis, you're going to assess the right upper quadrant pain or tenderness, which may signal cholecystitis, and you're going to press your fingertips under the liver border at the right costal margin and ask the patient to deeply inhale. So, karon sir, I want you to deeply inhale, sir. Okay. Sige, inhale deeply. Exhale. Again, inhale. Exhale. Inhale. Exhale. Okay. So, karon sir, we're done with your examination, sir. Pwede na ka mag-answer. Sandig. So, moving on to the termination phase, you're going to review the information obtained during the assessment and discuss findings to the client. So, present to the client the possible plans to resolve health concerns if there are any. And so karon sir, I'm going to discuss to you our findings. So, we're going to review the informations that we have obtained during the assessment. So the procedure went well and there are no abnormalities found. So, your abdominal area or your overall health in your abdomen is healthy. So, that's very good, sir. So, next is you're going to measure the client's understanding of the plan and need for further teaching. So, provide the client the opportunity to clarify and ask questions or ask any concerns. So, na ba kay concerns or any questions during our assessment or any concerns at all, sir?
No, nice.
So, wala lang kay mga pangutana. Wala kay nafilain nga wala lang nato nabantayan? Okay. So, next is you're going to end the interview politely. So, thank you for your cooperation, sir. So, our procedure went smoothly and maintain your healthy lifestyle, sir, ha?
Okay, nice.
Okay, thank you. Then you're going to do aftercare and fix your equipment and arrange it properly. Next is you're going to perform hand washing or hand hygiene. Then you're going to document the findings on the client's record. So that's it for assessing the abdomen. I hope you learned something. Thank you and get blessed.